Namaste, this is Usha Kiran Subba from Nepal. Today I am speaking on the topic climate change and mental health in a digital world. Climate change has become a global agenda because of the possibility of global natural disaster and the apparent imbalance between the environment and humans. Climate change is a global phenomena with effects on multiple sectors and is considered a defining issue of our time. It goes a major global concern due to the rapid change in mean temperature and its impact on the livelihood of people resulting from melting of ice, snow cover, glacial lake, outburst floods, landslides, sea level rise, frequent change in rainfall pattern all over the world. Impacts of the climate change can be visible both in developed and developing countries. However, people in developing countries are more susceptible to them. Climate change represents a significant global threat that will have a broad-ranging effects on human health. Climate change has impact on large part of the population in different geographical areas and with different types of threats to public health. Climate change is understood as impacting mental health through three pathways: direct exposure to climate related extreme weather events, for example, floods, wildfires, drought; indirect temperature such as impacts results from extreme weather events, disruption of access to resources, forced relocations, and via the awareness of climate change can lead to job loss, force people to move, and harm social cohesion and community resources, all of which have a mental health consequences. In addition, fear of the phenomena of climate change and related consequences for our national security and individual well-being can cause significant distress. The mental health consequences of single disaster for most people include mild stress and insomnia, high-risk coping behavior such as increased alcohol use, and mental disorders such as depression, anxiety, post-traumatic stress. Surveys are revealing that experiencing the effects of climate change and awareness of threats can lead to psychological responses such as chronic fear of environmental doom, known as eco-anxiety, eco-distress, climate anxiety, and climate grief, and other terms used. In a 2021 survey of 10,000 people aged 16 to 25 in 10 countries, nearly 60% of respondents were highly worried about climate change, and more than 45% said their feeling about climate change affected their daily life, such as their ability to walk or sleep. Indigenous persons, children, older adults, and climate migrants were among the vulnerable population whose mental health was most impacted by climate change. The most prevalent mental health responses to climate change included solastalgia, suicidality, depressions, anxiety, eco-anxiety, PTSD, substance use, insomnia, and behavioral disturbance. Mental health professionals and other healthcare providers have the opportunity to mitigate the mental health impact of climate change among vulnerable populations through assessment, preventive education and care, an inclusive and trauma-informed response to climate-related disaster, use of validated measures of mental health, and a long-term therapeutic relationship that extends beyond the immediate consequences of climate change-related events are approaches to successful mental health care in a climate-changing world. The intersecting challenges of climate change and mental health have emerged as critical issues facing global society. In response to these growing concerns, digital tools have emerged as a promising approach to reduce the mental health toll of climate change. Nowadays, people throughout the world have been linked with digital health and technologies. An unparalleled level of technological advancement is taking place. When digital technology helps people achieve their goals, they feel satisfied. Google, in an atmosphere characterized by excessive digital communication, a state in which one's subjective and well-being is maintained. When people are in a state of digital well-being, they can use digital media in a way that makes them feel comfortable, secure, content, and fulfilled. There is a bi-directional relationship between climate change, mental health, and digital well-being. Climate change drives mental distress like eco-anxiety, while digital environment act as both a source of the anxiety via doom scrolling, misinformations, and a necessary tool for support. Balancing screen time essential to managing climate-related mental health impacts while staying informed and connected. The ideal balance is an individual subjective perception between the benefits and drawbacks of mobile connectivity. A combination of emotional and cognitive responses to the integration of digital connectivity into everyday life constitutes the state of mind. Anytime a person uses a digital device, whether intentionally or unintentionally, a digital trace or footprint is left behind. Health programs, e-health applications are pre-installed on various mobile phones that records our vitals, which is the fact that people are aware of. However, the device still has the health information served as it through digital wearable examples, smartphone, smart watches, mobile phones with inbuilt health applications for blood pressure, pulse rate, rhythm abnormality, oxygen saturations, physical exercise, calories burned, and respiratory rate. Other hand, social media use reactions, icons, social media charts, contents, types of social media use, duration of use, provide motivational, spiritual posts during the crisis phase of life, negative thoughts during the depressions, time trends, and forecasting of individuals' health status and taking appropriate actions. It is a high time now to redefine health by incorporating the digital well-being component, a state of complete physical, mental, social being, digital well-being, and not merely the absence of disease and infirmity. Concurrently, AI offers new opportunity to close knowledge gaps by synthesizing evidence, personalizing content, and rapid high quality educational materials. Ultimately, the integration of AI into health education must complement rather than replace the human connection that is central to healthcare. By combining innovative technology with compassionate, evidence informed care, healthcare providers can better support the mental health of patients in rapid changing climate while empowering families, communities with knowledge and tools that foster resilience. Digital tools such as machine learning and AI predictive driven methods must be developed by setting parameters, including prevention rates and epidemiological rates. They are crucial in mitigating the risk of environmental climate crisis on occupational safety and hygiene and air pollution, dust associated with the quality of life, employees and cyber threat correlated with ethical concern. Studies done by Edma Formolosh et al. 2023. Artificial intelligence, AI, and machine learning advancement can improve workplace safety by analyzing historical data and real time environmental inputs. AI driven predictive models can forecast hazards, assess inspector burnout, and implement preventive measures before incidents occur. Study done by Smith et al. 2019. AI can reduce occupational burnout by automating repetitive tasks and providing decision support, offering personalized well-being assessments and stress management recommendation for mental health initiatives within organization. Dustin et al. 2019. Yes, there is a growing body of research, reviews, and studies exploring the intersection of climate change, mental health, and artificial intelligence. Recent literature suggests that AI can be critical tools for mitigating the psychological impacts of climate change while also noting the ethical challenges and environmental cost of AI itself. Psychologists pausing AI competence and understanding of quality care that includes AI can safeguard users and themselves while maintaining the integrity of professions by prioritizing patients' well-being, promoting accuracy, sustaining trust, and taking care to avoid harm. Thank you. Namaste.